All right, so when we are talking about community health and the social legislation, this is what we will talk about now. So, community health. What is community health? This one concerns the transfer of information from health personnel it concerns the transfer of information from health professionals to the public. So the information comes from the health professionals to the public. This is what we are calling community health. It has got its own goals that it wants to achieve. So we are saying the transfer of information from health professionals to the public, right? Why is the information of health being transferred from the profession to the public? Because, one, it is focusing on maintenance, protection, improvement of health status. Community health focuses on the maintenance, protection, not promotion, and improvement of the health status of people groups. The health status of the people groups. And communities. As opposed to health of individual patients. As opposed to health of individual patients. When we are talking about people groups, what's the difference between people groups? Because we're saying community health focuses on the maintenance, protection, and improvement of health status of population groups and community and communities. So what is the difference between population groups and community? Is it not one and the same thing? Huh? Population groups and communities. Population groups have got specific characteristics that are similar, right? You can talk about the middle class, you can talk about the teenagers, you can talk about under 5. These are population groups. A group is made up of people that have got similar characteristics. Well, say community could be young ones, old ones, middle-aged ones, mad, normal, sick, health. Everybody else is in a community. But a population group has got specific characteristics that have made them come together, or that have enabled them to be part of a particular group. So we are saying this health community, it is focusing on population groups as well as communities. Unlike or as opposed to the health of individual patients. When you're going to the hospital, you go as an individual. You are treated as an individual. You're not treated as a community, you're not treated as a people group, but you are treated as an individual. And therefore, that's where the difference comes in between the community health and individual health. Are we clear there? Kodesh?
Yes.
Okay. So it focuses on geographical areas. These are characteristics of community health. So we are saying, one, it concerns the transfer of information from health professionals to the public. Two, it also focuses on maintenance of population groups and not individuals. It focuses on geographical areas. Community health focuses on geographical areas. So community health believes that prevention of diseases or prevention of illness and promotion of health should be in the community, by the community, for the community. Sounds like data. That says what? A teacher, not a teacher. It says for the community, whatever community. But anyway. So, community health, I am saying, believes in the prevention of illness and promotion of health. Believes in the prevention of illness and promotion of health. In the community, by the community, and for the community. So it means that the community should be in a position to take care of this. The prevention, promotion of the health should be in the community. Apart from that, it has to be done by the community. And as the community is doing it, it is also doing it for itself. So it has to be done in the community, by the community, for the community. Meaning that the beneficiaries are the community. The doers are it is done in the community. The doers are the community members. The beneficiaries are the community members. So you can see that if the community is able to, if the prevention of illness and promotion of health is happening in the community, by the community, for the community, there are going to be few members that are going to go to the hospital to seek for individual treatment, because at community level, everything else has been taken care of. So if the community is doing this, you can also see that children that are going to be coming out of this community, they are going to be children that are healthy, children that are safe. So the community is a place where a lot of work has to be done. If you are going to bring out productive members, if you're going to bring out healthy members, if you're going to bring out people that are conscious as far as illness is concerned, then it has to be, the community health has to be intensified. So when community health has been intensified, work at the entry point in the hospitals is also going to be reduced. The workload is going to be reduced. Why? The prevention levels or the prevention activities on the ground are better off. And if the prevention activities are better off, you can also be assured that the occurrence of diseases is also going to be minimized. So people have the right and duty to participate individually as well as collectively in their health and that of the children in the community. So it's a right of a person to participate or not. We've been hearing or seeing posters about if that's a community thing. They're doing it collectively because they are trying to prevent diseases. So a child that's coming from that village is growing up with that kind of knowledge to say you don't just defecate anywhere. Health education is the communication to empower people that is led by health education specialists. We know Skefa Jimoto. Skefa Jimoto is one of the people that I know that is involved in health education. Have you ever heard him sing? Yeah. So Skefa Shimoto is a singer, yes, but he works with the Ministry of Health. What he does is he sings. There are times when we see a car loaded with speakers and all, and people are singing about cholera, people are singing about COVID, people are singing about how you take care of the general cleanliness. So these guys are involved in that. So health education is a communication to empower people, and this is led by health education specialists. Do you have any question?